700,000 babies are born each year in England and Wales. About 1 in 8 of these babies will be admitted to a neonatal unit, which specialises in looking after babies who are born sick, small, or earlier than expected. Babies on the neonatal unit need round-the-clock support from a special team of doctors and nurses. They frequently need painful procedures like blood tests and need lines and tubes put in, all to help them breathe and feed and grow. But how do doctors know if a baby is in pain? A team of researchers in the paediatrics department at the University of Oxford are studying babies on the neonatal unit because they want to understand how babies feel pain and which analgesics can prevent or relieve pain in babies. So how do babies feel pain? When a doctor pricks a baby's heel for a blood test, special nerve cells in the skin called nociceptors are activated. An electrical impulse travels along the nerve cells, carrying information to the next set of nerve cells in the baby's spinal cord. The information then travels up the spinal cord to the baby's brain, where we believe it is transmitted to lots of different specialized brain areas. A child or an adult would then normally tell you that the blood test hurt, but babies cannot. Babies pull faces or cry sometimes when they have a blood test. Doctors and nurses try to use these facial expressions to judge whether a baby's in pain. Unfortunately, babies pull these faces when they're hungry, need a nappy change, or when they're tired and upset. This makes it very hard for doctors and nurses and parents to know what these faces mean. Researchers have studied facial expressions in babies and shown that very sick babies and babies born very early do not always make these faces. Is this because they're not in pain, or simply because these babies are unable to show us that they're in pain? To find out more about how babies feel pain, researchers at Oxford are focusing back in on the brain. EEG, which stands for electroencephalography, is a technique that allows you to record the electrical activity in the brain using small sensors which are placed on the baby's head. Researchers at Oxford have carefully studied changes in brain activity when babies are having painful procedures such as blood tests. They've now identified a pattern of pain-related brain activity. This pattern of brain activity can now be used to measure the effect of pain medications. In fact, it's being used right now in a clinical trial to find out if morphine works and reduces pain in babies. To understand which parts of the brain are involved in generating this electrical activity, researchers are also using MRI, which stands for magnetic resonance imaging. This is an exciting modern imaging technique which can produce beautiful detailed pictures of the brain, its connections and its activity. The MRI scanner is a big machine with a giant magnet with a varying magnetic field. Unlike an X-ray machine, there is no radiation involved and it is safe for pregnant mums and newborn babies. MRI has been extensively used in adults to learn more about how the brain processes pain. Our researchers at Oxford have now been pioneering its use in babies to learn more about how the developing brain processes pain. Premature babies have rapidly developing brains, with brain cells making up to 40,000 new connections per second. By studying babies with EEG and MRI, researchers hope to continue to unravel the mysteries of the developing brain. We would like to thank all of the parents and babies who have taken part in these important studies. For more information about the work of the PIPA group, please visit the website.